In this PowerPoint, we are looking at two views of the leg. This first picture here on the left is an anterior view. Most of these muscles are going to help dorsiflex the foot, which is moving the anterior portion of the foot up off the ground, leaving the heel down on the ground. This view here is a lateral view, which helps plantar flex as well as evert the foot. So the first muscle we see here is called the tibialis anterior because it lies directly anterior to the tibia. So if this is the tibia here, the larger bone, this muscle lies right in front of the tibia, tibialis anterior. If we were to look behind the tibia, there's a very deep muscle called the tibialis posterior. Next, we see a muscle known as the extensor digitorum longus. This muscle goes into the foot. If we follow the tendon, we see the tendon goes into 4 toes, so it is a digitorum, and it extends the toes. Over here at the lateral view, we see a muscle known as the fibularis, also known as the peroneus longus. There's a longus and a brevis. Fibularis longus and fibularis brevis. The brevis is more distal, so further down the leg than the longus, but it is shorter than the longus as well. Here we see a posterior view. On the left are superficial muscles. On the right is if we were to remove a couple of the superficial muscles. The large, distinctive calf muscle is the gastrocnemius. It is superficial. There's actually 2 large bellies to this muscle. So we have here the lateral belly and the medial belly or head of the gastrocnemius. If we were to remove the gastrocnemius, we would find the soleus, which is deep to the gastrocnemius. We also see a little bit of it without having to remove the gastrocnemius. A little bit of the soleus can be seen on each side. Both of these muscles share the calcaneal tendon, or the Achilles tendon. Deep to the soleus is the tibialis posterior. Again, this is a very deep muscle. You would have to remove both the gastrocnemius and the soleus to locate it. The flexor digitorum longus flexes the toes. Basically, to flex your toes would be to curl them under. And then there's the flexor hallucis longus muscle, which flexes the big toe. Now notice the orientation of these 2 muscles. The orientation is very counterintuitive. You would think that these muscles would be switched, since the big toe is medial. Here's the big toe. It's medial. And the other toes are lateral. So you would think this may be the hallucis, but indeed it is lateral to the flexor digitorum longus. Now we're in the foot, and I would handle the foot just like you handle a hand. Look closely at the muscle. Look closely where the muscle is pulling from, aka the origin. Notice where the insertion is, and imagine if that muscle shortens or contracts, what would it do to that insertion point? So this is a plantar view, so we're on the bottom of the foot. These muscles are called intrinsic muscles of the foot because they are found within the foot and move toes. There are muscles on the bottom of the foot, which are known as plantars. There are muscles on the top of the foot, which are known as dorsals. This muscle here is called the abductor digiti minimi because it abducts the little toe. So notice it comes off the heel, the calcaneus. It inserts on the lateral portion of the little toe, and it would move that little toe away, or abduct. Abductor digiti minimi. The one right on the bottom is called the flexor digitorum brevis. We've learned a flexor digitorum longus, but this one is the brevis. And you can imagine if it's pulling from back here on all those toes would curl under. In other words, they would flex. This muscle here is an abductor. It abducts the big toe, or hallux. And you can imagine by pulling on that insertion point, it would pull that big toe away, so it would be an abductor hallucis. So make sure you check your list, because there are more muscles than this on the list. But if you look closely at the muscle and where it inserts, it will tell you the name of that muscle, whether it is an abductor, a flexor, an extensor, an adductor. So that is the end of muscles of the leg.